Risk factors for thyroid cancer. Hello everyone. Today, we will be discussing the risk factors for thyroid cancer. The thyroid gland functions to produce hormones that regulate heart rate, blood pressure, body temperature, and weight. Thyroid cancer occurs in the cells of the thyroid gland located in the lower part of the neck. In the United States, thyroid cancer ranks 5th among all types of cancer in terms of prevalence. Understanding the risk factors can help us take steps to prevent it. So, what are the risk factors for thyroid cancer? Unmodifiable risk factors for thyroid cancer. Gender and age. For reasons not fully understood, the incidence of thyroid cancer, like many thyroid diseases, is about 3 times higher in women than in men. While thyroid cancer can occur at any age, the risk peaks earlier for women, usually around the age of 40 or 50 at diagnosis, compared to men typically diagnosed around the age of 60 or 70. Genetic disorders. Certain genetic disorders and family history are associated with various types of thyroid cancer. However, most individuals developing thyroid cancer do not have a family history of the disease. Medullary thyroid cancer (MTC). About 2 in 10 cases of medullary thyroid cancer result from abnormal genes. These cases are termed familial medullary thyroid cancer (FMC). FMC may occur alone or be found in conjunction with other tumors. The combination of FMC and tumors of other endocrine glands is known as multiple endocrine neoplasia type 2 MEN2, which has 2 forms: MEN2A and MEN2B, both caused by mutations in the RET gene. In MEN2A, MTC occurs along with tumors of the adrenal glands producing adrenaline and the parathyroid glands. In MEN2B, MTC is associated with adrenal gland tumors and benign nerve tissue, growth on the tongue and other areas, known as neurofibromatosis. MEN2B is much less common than MEN2A. In these inherited forms of MTC, cancer tends to develop in childhood or early adulthood and may spread early. If MEN2A, MEN2B, or FMC runs in your family, you may have a significantly increased risk of developing MTC. Therefore, regular blood tests or genetic testing should be discussed with your doctor for early detection. Other types of thyroid cancer. Individuals with specific rare genetic disorders may have a higher risk of common types of thyroid cancer. The risk of thyroid cancer is higher in people with the following rare genetic disorders: familial adenomatous polyposis (FAP). People with this syndrome develop numerous polyps in the colon, leading to a high risk of colon cancer. They also have an increased risk of developing thyroid cancer, including medullary thyroid carcinoma. Gardner syndrome is a subtype of FAP, where patients also develop some benign tumors. Both Gardner syndrome and FAP result from mutations in the APC gene. Cowden syndrome. Individuals with this syndrome have an increased risk of developing certain thyroid and benign growth disorders. They are also at risk for thyroid cancer, as well as cancers of the uterus, breast, and other organs. Thyroid cancer in this syndrome tends to be follicular or nodular. This syndrome is often caused by mutations in the TEN gene. Carney complex type I. People with this syndrome may develop various benign tumors and hormone-related issues. They also have an increased risk of follicular and nodular thyroid cancer. Carney complex is caused by mutations in the PRCAR1 gene. Familial non-medullary thyroid carcinoma. This type of thyroid cancer occurs more frequently in certain families and is often diagnosed at a very young age. Currently, scientists suspect mutations in chromosome 19 and chromosome 1 may contribute to this type of cancer. Family history: having first-degree relatives, parents, siblings, or children with thyroid cancer, even without an apparent genetic syndrome in the family, also increases your risk of thyroid cancer. The genetic basis for these cases is not entirely clear. Modifiable risk factors. Radiation exposure. Exposure to radiation has been established as a risk factor for thyroid cancer. Sources of radiation exposure include certain medical treatments and fallout from nuclear power plant accidents or nuclear weapons. Children who undergo radiation therapy to the head or neck are at an increased risk of developing thyroid cancer later in life. The risk depends on the dose of radiation and the age of the child at the time of treatment. Generally, the risk increases with higher doses and younger ages. At treatment. Before the 1960s, children were sometimes treated with low-dose radiation for conditions that are no longer treated this way, such as acne, fungal infections of the scalp, or enlarged tonsils and adenoids. Many years later, those treated were found to have an elevated risk of thyroid cancer. Thyroid cancer following radiation treatment is not more aggressive than other thyroid cancers. Diagnostic imaging tests like X-rays and CT scans also expose children to radiation, but at much lower doses. Therefore, it is unclear how much these imaging techniques may increase the risk of thyroid cancer or other cancers. If there is an increased risk, it is likely to be very small, but to be safe, children should avoid these tests unless absolutely necessary. When necessary, imaging in children should be performed using the lowest radiation dose that still provides clear images. Some studies have indicated an increased risk of thyroid cancer in children due to radiation exposure from nuclear weapons or nuclear power plant accidents. For example, thyroid cancer rates were much higher in children living near Chernobyl, where a nuclear power plant accident occurred in 1986, exposing millions to radiation. Adults involved in the cleanup after the accident and those living close to the plant also had higher rates of thyroid cancer than in other locations. Children with higher iodine intake in their diet seem to have a lower risk. Exposure to radiation as an adult is a lower risk factor for developing thyroid cancer. Overweight or obesity. According to the International Agency for Research on Cancer (IARC), individuals who are overweight or obese have a higher risk of developing thyroid cancer compared to those with normal weight. The risk increases with a higher body mass index (BMI). Dietary iodine. Thyroid cancer is more prevalent in regions of the world where the population has very little iodine in their diet. Conversely, a diet rich in iodine may increase the risk of follicular thyroid cancer. In the United States, most people have sufficient iodine in their diet because it is supplemented in table salt and other foods. Once again, thank you so much for watching this video, and I'll see you in the next one. Take care, and have a fantastic day.